Welcome to Let's Talk Lupus. How does lupus affect sexual activity and fertility? Well, Dr. Steiman is here to discuss that very question in this month's edition of Let's Talk Lupus.
One question that I don't get asked enough is whether lupus impacts sexual activity. And this is such an important question, and I think difficult to unpack with generalities and in such a short time frame. I will say that in general, the relationship between any chronic disease and sexuality is complex. And I think it's important to acknowledge that lupus can have unique impact on all aspects of a person's life and identity, and sexual health is no exception. And so because lupus can cause pain, fatigue, changes in mucous membranes, and even in self-perception and confidence and mood, the impact of lupus on sexual health can be profound. And all this said, patients with lupus can lead sexual lives that they hope to, and without any contraindications from a disease standpoint. And it's in this context that I'll say that it's always important for patients with lupus to discuss best options for contraception with their rheumatologist for a couple of reasons. And the first is that some patients can have antibodies that increase the risk of clotting with some oral contraceptives. The other issue is that some lupus medications can be harmful to the fetus if taken while pregnant, and that really underscores the importance of discussing contraception and pregnancy planning as a part of a routine lupus visit. Now, with respect to the impact of lupus on fertility, I'll say that for most patients who embark on a pregnancy with disease well controlled, lupus does not impact fertility, and many patients with lupus enjoy healthy pregnancies. And we say healthy mom, healthy baby. I'll add that high doses of a drug called cyclophosphamide used for severe disease can decrease fertility potential if used over the long term in both men and women, but this medication isn't used very commonly. Lupus can impact pregnancy outcomes through severe disease activity and or the presence of certain autoantibodies that can cause pregnancy complications. However, neither of these actually directly impacts fertility as much as how the pregnancy progresses.